of one test, that was RT-PCR, which is a very, very sensitive test. It can pick up even dead particles. The virus has come or gone, nobody knows. The person may not be infectious. And in a medicine, firstly, person has symptoms, then the test, then the diagnosis. Here, the test is done, and then the person is labeled as a case, and then you start contact tracing. So these measures are very good at the start of a pandemic in beginning, where you can contain it. But once it has spread across the globe, then in the different countries, it has spread in the general population. These measures are not cost effective. They are very resource intensive, they are costly, they create panic, they just increase the case numbers. And you will be surprised to know this was started on one case report published in New England Journal of Medicine, that one lady went from, I think, China or some Asian countries to Germany or USA, and she was asymptomatic, she infected others. So just on basis of one case report.
That is very interesting. I know the study. It has been done by Charité in Berlin. And it's really an interesting study because, first of all, it's wrong. The lady had strong symptoms and took a lot of medication to contain them.
Yeah, that came out later.
Yeah. Secondly, it is very surprising that a team of researchers went from Berlin to Munich to test a woman coming from Wuhan who had a cold, while at the same day, about 100,000 people in Germany had a cold. Why would they test not somebody in Berlin? Why would they use this test, which has never been used, to test a woman who is like 800 kilometers away in a smaller town than the big town of Berlin? It is a surprising study because it feels like you want to find this and not that, you know.
As if you have decided that this lady will go from here. She is asymptomatic, first of all, as per that time, when it was first published, she had no symptoms, she goes there. Then you have to take care of the asymptomatic also. They have to poke in the throat and nose to find out.
Sure.
So that is something which has never been done in public health history.
Yes.
And later it was found that she had symptoms and she was taking medication. But the initial publicity was enough to put the fear in the minds of people.
So this even has been a reference in India and in Malaysia, this very study?
These references are like this. Like the WHO says, the CDC says that there is asymptomatic spread. All India, Sri Lanka, Malaysia, all countries follow the WHO guidelines. They, without doing their own studies, they just follow the WHO guidelines. So whatever initial impact has been done, and it is another very peculiar thing in this pandemic is like usually you quarantine, so-called quarantine, or restrict the movement of people who are sick.
Yes.
Here you have put the healthy people, young people, healthy people, and anyway, initially fear was justified, I would say, first couple of months, because when they took the data from Italy, and one of the published paper in Lancet had estimated the case fatality rate of 20%. So 20% is quite serious. I mean, there anybody would be panicked, 20% mortality. But later it was based on the hospital cases, who are serious cases, elderly cases, and the mean age of death was 80 years, very elderly population. And based on that type of false inputs, certain models, Neil Ferguson models and other models, and the projection was there will be millions of deaths in, say, UK, in other countries. And so that type of panic which was generated, it never subsided throughout the pandemic. And one of the principles of public health pandemic management is one should mitigate panic. Here it was opposite. Everybody wanted to increase the panic level. And later, in fact, within the first 3-4 months only, the California University, Stanford people did some studies, sero surveys in California, Jay Bhattacharya, John Ionitz. So they found a large number of asymptomatic spread in the community, which increased the denominator. And their estimate of the infection fatality rate was 0.3%. 0.27 or 0.3%, because so many people got infected, so many landed up in hospital, most of them 80% and other things were asymptomatic cases.
And even this has been based on the testing, which includes
Antibody test. They did some
Antibody test,
antibody
yeah,
test. That's
exactly.
the antibodies. They had like these antibodies. They capture the past infection. RT-PCR is supposed to capture the present infection, whatever it is, whether it is just a RT-PCR or some nucleic acid particle lying there. So this was, but that study was very much criticized and all that. So anyway, that was somewhere. But very early in the pandemic, we knew that the fatality was not as much as initially projected, firstly. Secondly, even data from China and other data from other countries, they found almost 1,000-fold difference in the risk according to the age. Children were at almost negligible risk. Elderly were at above 80-year-old person and a 80-year-old person, there was 1,000-fold difference in risk.
I understand this. So from the beginning on, you've been very methodological.
Yeah.
You're trying to put numbers into context.
Yes.
And you want to show maybe some of your work?
Yes.
I will open the computer. Here it is.